know you tell the truth. You tell the truth. You tell the truth.
Welcome to Thrive with Morella. This is the show for people who want to thrive, body, mind, heart, and spirit. We had a couple seconds delay there because I was fidgeting in the radio booth. But I'm joined today by Dr. Andrea Fossati. She is an MD and an integrative medicine practitioner. Let me tell you a little bit about Dr. Fossati. She is a physician, leader in integrative health at the University of Vermont, and an instructor at the Larner College of Medicine and the UVM College of Nursing and Health Sciences. She established UVM's Integrative Medicine Consult Service 5 years ago and currently sees patients by referral at the Apple Tree Bay Primary Care Faculty Practice in Burlington. Dr. Fossati is board certified in internal medicine and also previously board certified cardiologist. She became interested in helping her patients make lifestyle changes to promote their optimal health and well-being, leading her to adjust her career path. Andrea, welcome to Thrive with Morella.
Thanks, Morella. It's wonderful to be here.
It's lovely to have you. I'm just going to adjust your mic a little bit. So the first question every Thrive with Morella gets is, tell us, what is one of your personal keys to thriving in life?
It's a great question. I think for me, one of the best answers is that I've always followed my passion. And that stands in all parts of my life. And it is how I wound up in the career that I have. And how I learned all of the self-care techniques that I use for myself and my patients. And there are many. So yeah.
I love it.
Yeah.
You know, we get a lot of guests that talk about going out in nature. Our last episode, someone said, you know, connecting to community. And I love that you took us into following your passion, kind of connecting with the joy in your heart, what gets you excited.
Yes.
You know, you wouldn't expect an MD to say that, you know?
This is true. I do have a girlfriend who told me at one point that I went from being a heart doctor to a heart-centered doctor.
Oh,
I think that's accurate.
Oh, I like that.
Yeah.
Being a heart doctor of the physical heart to being a heart-centered doctor, talking
Yes.
about the joy in people's hearts.
Yes.
I love that. Okay, so we already know that you're not your average MD. So now you also obviously practice integrative medicine, and
I do.
I know it's obviously a growing field, but a lot of people are not familiar with integrative medicine, may have never heard of it. They might hear integrative medicine and think, you know, maybe associated with internal medicine and think that that's what it refers to. So
Right.
What is integrative medicine?
Another great question. So it's funny, if you're an orthopedic surgeon and someone says, what do you do in an elevator? And the orthopod says, I'm an orthopedic surgeon. Everybody kind of knows what that is. So I think everyone should have a bit of an elevator definition. And when someone asks me what I do as an integrative physician, I tell them that I combine intelligently conventional medicine and complementary therapies to help optimize patients' health and wellness.
Okay.
Yeah,
So combining the best of both worlds.
exactly.
Lovely. So then how is your practice different? You know, what can people expect if they come to see you? How are you different from a traditional PCP?
So I do not practice primary care, but I do work in a primary care setting. That said, I work as a consultant. So I am sent patients from across the board at UVM and actually from our community as well. I share patients sometimes with naturopaths even and other providers. I see patients who are interested in more lifestyle change, more of a holistic approach to their care. I see a lot of patients who have fallen through the cracks, if you will, in conventional medicine. And my approach is, when I'm referred a patient, whether it's from the cancer center, rheumatology, primary care, wherever, my approach is to really spend a lot of time with the patient. So my first visit is quite long. It's over 60 minutes, which it sounds like a long time, but it flies by. And I always tell folks that my job is to take a bird's eye view of what's been going on for them. So part of what I do is I look at everything, really. I ask them to share their story with me, and we start there. And as we unpack that, I look for patterns. I look for connections, as you do. And one of my favorite questions to ask someone would be, what was going on in your life when these symptoms started? When is the last time that you felt really well? So starting to pull those pieces together. And then after we do a broad view, an overview, I start talking to them about lifestyle, how they eat, how they sleep, how they move, how they relax, how they rest, and how they're connected. I look for exposures in their life, whether it's been toxic relationships or toxic exposures to materials. And so I just take a broader look, and that's how I'm different. So what I do complements the work that their primary care physician does or that their rheumatologist does.
Got it. So that's a really important distinction for me, because I was envisioning as somewhat of an alternative primary care physician. So you're kind of more of a gateway, right?
Yes.
Where the primary care physician refers to you, or maybe a naturopath refers to you, and then you can, you're kind of a triage gateway type of a...
I help connect people to where they need to be, but I also do one-on-one work with them. So when I see someone, I see them that first visit, and then we meet several times afterwards, depending on what their needs are. But that's my role.
I love it.
Yeah.
So you said that you help people who, and I'm sure many, many more than what I'm about to say, but I really liked how you said some of the people who've fallen through the cracks. So can you give us some example of someone or types of diagnoses or types of conditions or situations of people who fall through the cracks and it's like nobody seems to find anything to help? So who are some of those people?
So it's funny. Last year I was asked to give a talk to the rheumatologists, and it was a great invitation from one of the rheumatologists at UVM. And I thought, now, what are they going to want to know about what I do? And what I brought to them were exactly the patients that fall through their cracks. So, for example, patients who have chronic pain, fibromyalgia would be a great example. There are conventional therapies that can be used, but oftentimes patients don't really thrive with those therapies. And they have great value, but there's so much more that can be done. I'll also say that this is an application that can be used across all of medicine. So as a cardiologist in the past, I would see many patients who are on antihypertensives or anti-hyperlipidemics. So we always treat to get rid of symptoms in medicine. And I know that in conventional medicine, we do look for the unifying diagnosis, but from an integrative and functional medicine perspective, we're really looking for root cause. And we don't separate just medicine from lifestyle. So you can have a patient who's taking 3 blood pressure medicines, who is lifestyling their way out of good health and eating stuff that's going to raise their blood pressure, or not relaxing, not getting enough sleep, gaining weight, that kind of thing. So I can see patients, any kind of patient really, and help them pull those two things together. When I work with the rheumatologists, my job is not to get these folks off of their biologics, for example. But it is to help them feel their best on those medications, because there's value in using. I was first a conventional physician, so I have many years of training in that. And there is value to many of the conventional therapies that we use, obviously, but I think it's too restrictive.
So let's say, for example, you have someone who comes to you with rheumatoid arthritis and they're taking all of their medication, their biologic or whatever. And so what are some of the things that you are able to help them with that they're not getting?
Great question. So rheumatoid arthritis is one of the types of patients that I definitely see. Autoimmune disease, I would say, across the board is evolving. It's becoming much more commonplace. And so one of the questions I have in my mind is, like, why is that?
What's happening?
What's going on that is causing this kind of burgeoning of these patients?
Right.
And one of the examples, when I think of rheumatoid arthritis, one of the examples that I gave to our rheumatologist was I drew kind of a picture of the timeline through a person's life. So what they might have seen in the past. They might have had, for example, food sensitivities as a kid. As a young adult, they might have started having redness or swelling on occasion in different joints. They may have moved into a stressful circumstance or an environment where they were exposed to, who knows, mold or something like that, right? And what you see when you look back at a history like that is that these threads all come together, and eventually, the way I describe it to patients is they tip over into having a chronic disease. It becomes more and more common in their day-to-day life. It's sort of underneath the surface, but it can come up and become more and more present. So some of the things that I look for, and with autoimmunity, I always say this to patients when they come in, like, I'm going to talk to you, I'm going to reflect back to you as you tell me your story, some of my thoughts, just as we go forward. And you're probably going to hear some things in here that you may not have heard elsewhere. And unless they've seen a naturopathic physician or another functional medicine or integrative medicine physician, I'll say, okay, autoimmunity, rheumatoid arthritis, we're going to start talking about gut and gut health. And folks just kind of like, they are either astonished and excited about that, or they've already read about it, but no physician has ever actually had that conversation. And I'll use the term leaky gut because that's something that is in a lot of media and people have heard of it. And I'll explain that in conventional medicine, this is now coming into alignment with the concept of leaky gut. We have rebranded it in conventional medicine as we do many things, and it's now increased intestinal permeability. So it just, it's got that that whole shtick to it. But I will start having conversations about things like gut health. And even if they're not having gut symptoms specifically, we do talk about how those two things can be related.
And so let's, going back to the rheumatoid arthritis patient, or, maybe it's a lupus patient, or, Crohn's patient. So now they're talking to you and they say, yep, I'm taking all of the medications that my doctor provided. And now you're talking to them about history and potential, kind of the development over their lifetime of this situation, and then potentially the increased intestinal permeability, leaky gut. So then what does that lead to for them in terms of new things or pathways that they're pursuing for their health?
So with every patient I work with, I approach them sort of from the broad perspective, but then the work that we do is related to those details that I mentioned earlier that we talk about as we go through their first visit. So with each patient, I create a protocol for them or a treatment plan that's individualized. I mean, there's a lot of overlap, obviously. But in a patient with rheumatoid arthritis or autoimmunity, we would start with nutritional recommendations and talk about what that means. What does an autoimmune protocol, for example, look like? What does an elimination diet look like? Is there something in our history as we're talking together that sort of jumps out at me that I think, oh, well, okay, let's maybe get you off of gluten and dairy to start with because those are the most likely things based on what you're telling me? Or are we going to be more broad about it? At the same time, when I take a very detailed nutritional history, I look for gaps is really the best way to put it. So if I have someone who is a vegetarian and has no beef intake, and I'm wondering, is their iron low? Is their ferritin level low? It's a marker of iron storage. Could that be creating some of their discomfort in their joints? Are they not getting any omega-3 at all? are they not getting any that is really usable by their body or high enough doses? So I start looking for those gaps, and we talk about filling those in with supplements. Now we've got a nutritional, say an elimination diet for an autoimmune patient. We have supplements that are used to fill in some of the gaps. And then we talk about movement. We also talk about a lot of patients who have autoimmune disease or any disease wind up having circadian dysregulation. So they have sleep problems. And sleep is a main foundation for good health.
Right.
You have to be able to restore your body to rest.
Yeah.
And we all go through life kind of exhausting ourselves. So it's good to have a check-in about that as well. We talk about how to get good, healthy sleep. There's a lot of almost health coaching that goes on, but from I would say from a slightly different perspective.
Yeah. Well, and you've already mentioned a couple of things that sound radically different than what we typically hear an MD say. You know, for one, you said root cause, you know, in terms of from the medical perspective, we hear like we're looking for the cure, we're looking for the cure, we're looking for the cure, but very rarely, or, you know, what you said, you know, looking at addressing symptoms is typically, you know, what I've become used to associating with allopathic medicine, you know, Western medicine. But rarely do we hear, well, what's the cause? What's causing this autoimmune epidemic that we seem to be seeing, right?
Right.
So root cause, so you're looking for the root causes, the history, how did this develop? You're talking about, oh, the second one escaped me. Oh, of course, food.
Yeah. Food is huge.
It's huge.
Yeah.
And, you know, the first time that I remember, and I've heard this over the years a number of times, you know, being in this field of, you know, kind of health and healing and thriving, I remember my best friend from high school, she had a long battle with cancer, and she's doing phenomenally well now, has been in remission now for a number of years. But I remember when she first started, and I asked her, and I was seeing her eat not particularly well, and I was just like, oh, you know, you're going through cancer, and this isn't, I don't know. And I asked her, so what does your doctor say about food? Oh, no, they said I can eat anything, doesn't really matter, makes no difference. Just this past week, a friend was telling me about her dad's, you know, he has some leukemia, he has prostate cancer, and he asked his doctors, what should I be eating? Like, you know, just keep doing what you're doing. It's like, wait a minute.
Yeah, no.
No. So thank you.
Yes.
So talk to us about that kind of change in paradigm.
Where to even start? So first of all, thank you for mentioning that. It's a very big factor. The way that we live our life, food is, it is said that food is medicine. It's the most common medicine that we put into our body, but I actually love the comment that food is information even more, because food has the potential to turn on inflammation, turn on cancer genes, turn them off, okay? Food has the possibility of creating whole new vibrant systems in your body. Your cells turn over every 7 years or whatever it is, but you use the building blocks of what you're actually eating to create those cells. And the way that we are eating in this culture, we have plenty of data to show that it correlates with disease. So folks who move here from other cultures, for example, Asian cultures, women don't tend to have breast cancer as often. Once their diet is westernized, they develop within one generation the same level of cancer as we have now. So in our own culture. So we're clearly doing something that is not working from a health perspective, even from a global health perspective. And food is absolutely one of the most powerful things that we can use. So in a cancer patient, that's a great example because it comes with its own challenges. So we know that anti-inflammatory eating, Mediterranean type diet helps patients thrive, and whatever their circumstances. That said, when someone is going through chemotherapy, for example, their appetite is poor, they have a lot of symptoms related to their cancer, they have fatigue from the therapies, they might have nausea and inability to keep foods down. So at that point, two things I would say. One is don't eat your favorite foods, okay? Because you're going to associate that with, and two, I'm just going to say sugar drives cancer. So don't eat sugar. I've had so many patients come in and say, well, my doctor told me I have this neurologic disease or this cancer, and just to get the calories in me. But the idea is to step back and see, how can we nourish you?
Right.
If you don't have much of an appetite, let's give you some bone broth with some cooked veggies in there that are going to actually help you. And if you don't care for it that much, it's okay, because it's going to be nutritionally valid.
Right.
And so getting just a little bit of that is going to go a long way. I had one patient who was only able to eat like Italian ices. I think they were watermelon ice or something. Like, that's all she could eat with her
because of
chemo.
Right.
She felt so sick, and she said, well, they said it was okay. And I said, wait, okay, let's try this. Get rid of that, and let's just take watermelon, puree it, stick it in the freezer, and see how you do. And she started improving. Her fatigue started lessening because she wasn't on high fructose corn syrup, which is 50 times as sweet as, regular sugar. And there is something to be said for really...
And that there is a chemistry in a watermelon that's not in watermelon flavor.
Exactly. It's not artificial. There are phytonutrients that are in there that we don't even understand. Yes, and they combine beautifully to have an antioxidant effect that we can't just distill out and put into one anthocyanin or something. Here, take this pill with 50,000 times the dose of what you were getting in your watermelon.
Exactly.
Yeah.
That's the thing that I have long thought about food, and it's not, my original thought. I think, just kind of distilled from reading a lot around food is that there's a wisdom in nature, in the biochemistry of nature of foods, that we are far from understanding.
Yes.
That, we can break it down. It's like, oh, here's a vitamin C molecule. This is a glucose molecule. And fat, that's how far our microscopes have gotten. But it doesn't tell the whole picture. And what you just said, that, there's this wisdom in nature, in food, that we are so far from understanding how it acts like a key in our body. So thank you.
Yes.
And you're inside the medical world, so it's like I'm throwing a little party. Because for a long time, it's felt like there's the medical world, and then there's all of us crazies over here doing the non-scientific,
non-traditional. I would say there are many thousands of years of experience with those kinds of things. And honestly, our bodies as humans have developed alongside plants. And so herbal medicine and honoring food is a big part of what we do in integrative medicine. I would say it's coming into more of mainstream with conventional physicians. I've seen plenty of folks send me patients, for example, with digestive issues who've already tried a low FODMAPs diet or an elimination diet or whatever. And so we're actually starting to open to it, but it's not something that we're typically taught in medical school. That said, we are starting to teach it in medical school here at UVM. Our Integrative Health Initiative is really bringing culinary medicine to our students and even to our patients.
That's fantastic.
Yes.
That's just so great. So what's the response you're seeing from the established medical community that has been practicing for, decades, and they're seeing you in this field? What's the reaction you get?
I'd say it's a sigh of relief. Really.
That's wonderful.
Yeah, I have deep respect for my colleagues. I have been, as I said, a conventional doctor my entire medical career. I just have something extra now. And what I would say is my rheumatology colleagues, for example, they are grateful when they can send a patient to me who can work on these things in a more individualized setting. And they have had really good responses with it. So I've been able to keep patients on medications that they might not have otherwise have been able to have, weight loss, better nutrition, so that they don't need as much medicine, for example. And I didn't know how it was going to be received when I started at UVM 5 years ago. Interestingly, I started at a practice called Aesculapius, which Aesculapius was the first integrative physician in Greece, by the way. So I thought that was kind of cool. And so there in South Burlington, I worked alongside of other primary care physicians who really just loved it. They would send me patients. They picked up different techniques that I used, and it expanded what they were able to offer their own patients. And So I think that because I do quality work and I follow through and I communicate really well and I take great care of my patients, they were able to see that up close and personal. And my entire practice is based on word of mouth. I don't think I've ever been marketed yet. It's kind of funny. So I have a waiting list. I have patients coming in, and I've moved over to the nurse practitioner faculty practice at the College of Nursing, because that is where integrative health is really housed at UVM. And again, my patients have followed me there. I've had referrals from across the board. So I think there is an appreciation. Now, once in a while, you step on some toes. You might have a specialist who says, "Oh, I don't believe in this or that." But honestly, the proof is in the pudding. The patient is feeling better. They're doing better. They're getting their questions answered. And it is something that empowers patients.
Yeah.
I think so often with chronic disease, patients are disempowered, and the locus of control for something like cancer, for example, is outside of them. They have to depend on others to give them chemotherapy or to do surgery on them. And so inviting them to really be part of that healing process, your body does best when it is more relaxed. Your body does best when it has proper ingredients and nutrition and clean water and connection. And so providing that initial conversation for many of them helps. As you said, I'm a gateway, and also it just helps the conventional docs. So I think they're happy about it.
Wonderful. That's so great to hear. So I'm curious about whether there's a distinction, and it sounds as though there is. I'm just not entirely sure what it is. If there's a distinction between integrative medicine and functional medicine.
So I was trained initially in integrative medicine, and it was interesting. As I graduated that program with my colleagues, I think there were about 62 of us from all over the country and world at the Arizona Center for Integrative Medicine. Some of my colleagues said, "Well, now we've got to go off and do our functional medicine training." And I was like, "I just finished this. There's no way." So I kind of put it on the back shelf. What I can tell you is that as I started practicing integrative medicine, I looked for more answers to some of the questions that I had physiologically, biochemically. And so functional medicine, I think, is very close to integrative medicine. I would say that integrative medicine uses modalities like nutrition, supplements, mind-body, movement, sleep, all the stuff that we talked about already. So does functional medicine, but functional medicine breaks it down in a slightly different way and really looks probably more for the root cause. And to me, it connected some of the dots that I for example, I would always say to women who are going through menopause and having hot flashes, okay, so let's do some breathing techniques. It's shown to help improve your quality of life and reduce hot flashes. But when I did my functional medicine training in hormones, I realized that there's something called cortisol steal, which means that if you're creating cortisol from your cholesterol molecule, you're not creating other hormones, other female hormones. And so that is why relaxation therapies and practices that are regular are going to reduce your cortisol and allow you to produce what you're producing. And that's why your hot flashes are getting better. So to me, it just kind of filled in some of those blanks.
Wonderful.
Yep.
So perfect moment to transition we're going to say goodbye to our TV friends shortly, but I want to let you know that you can continue watching and listening. You can listen to the podcast on the podcast page, which is thrivewithmorella.com/podcast, or continue watching on YouTube on the Morella Devo channel on YouTube. And if you want to find more information about Andrea Fossati's, Dr. Fossati's practice, you will find a link on the podcast page. That's thrivewithmorella.com/podcast. Thank you for joining us today. We'll continue chatting with Dr. Fossati about integrative medicine and some of the amazing outcomes that you've seen. So for some of the people, I'm thinking we can get How far, what have you seen?
So what I would say is there's a difference between healing and curing. So you can't cure everyone, but you can help them optimize their well-being wherever they are. That said, I've absolutely seen patients who have done much better in their lives. One of my favorite examples, this I wouldn't say was an incurable issue, but I did have a patient who was probably 56 or so and came in with 50 years of abdominal discomfort and had a really big workup over many, many years. And even 25 years ago had seen a really great integrative and functional medicine physician and got partial relief. So she came in, it's not like she had cancer, it's not like she had something that was, quote, incurable, right? But she had symptoms that weren't going away and had been there forever. So what we did, and she kind of said to me, "You're not going to change my diet around, are you?" Which all my patients know the answer to that is yes, she is, if you'll go along with it. So we took a look at what was going on for her, made some adjustments in her diet slightly. One was a big one, and changed around her supplements, gave her a relaxation practice. And the next time she came back, literally, her symptoms were 90% better. 90% better in one visit. After she left, I was like jumping up and down and happy. It's possible to help people feel better,
right,
regardless of what is going on for them. So for something like fibromyalgia, I'll give you another example, which can be thought of as sort of a diagnosis and a problem that you're going to have forever. I've had a patient who, first of all, there's a definite correlation between childhood trauma and fibromyalgia. So that is a conversation I have right up front. And some people don't know that, even if they suffer from fibromyalgia. So there's something called ACEs scored, Adverse Childhood Experience Score, and it correlates strongly with chronic pain, addiction, obesity, chronic disease, et cetera. And this particular patient, we unpacked that a bit, talked about it, and she was having symptom flares related to something that was going on currently in her life. And so we did some tapping on it, which is another thing your typical doctor doesn't do, but I love EFT tapping as a tool for patients. I know that you do that as well.
Yeah.
And we just did an initial kind of visit with that, and she tapped on it, came back the next time, this is a few visits in, and she said, "I don't know what happened, but it's like you threw that right out the window, and I feel better." So she was, again, 90% feeling better, sleeping better, able to move her body, and that was someone who probably 6 months earlier would not have believed that she would have that kind of response. And I wouldn't have known without having a deep conversation and relationship with her, sort of forming that bond. I wouldn't have really known to even try EFT tapping. It's not like you just tap with every fibromyalgia patient.
Of course.
So,
So I love, obviously, something you just said, and you know this about me, that I love the connection that you're making between the physical health and, emotional health. Or experiences, life experiences, trauma, and how trauma shows up in the body. Because that's the pathway that I've taken with my practice, is working on the trauma and resolving trauma as a way to, release some of the things that are happening in the body. Again, I don't know that I've ever heard any other MD, aside from maybe some of the famous ones who are writing books, but I've never sat with an MD who has made a link between childhood trauma, emotional trauma, and physical health. So is that something that is it just you, or do most integrative medicine practitioners dive into that as well?
I feel like it is something that we are becoming more aware of. So the ACEs studies, those were conventionally done. Those are traditional medicine studies. And so I feel like it's becoming more acknowledged in the culture. It's just that people don't know what to do about it.
Right.
So then that's where I'm lucky enough to have some tools that
Right.
that I can offer patients. Yes, I do think that depending on the kind of integrative physician that you are, because you kind of mentioned this earlier, so you can be an internist, you can be an integrative cardiologist, you can use integrative therapies regardless of what your specialty is. So I have a friend from fellowship who is an integrative gynecologist and obstetrician, so she helps people have really healthy babies and all that good stuff. So I do feel like it is something that is becoming more commonly known in medicine.
Wonderful. Yeah. So then the other piece that I wanted to ask you is from a functional medicine perspective, I know that there's a battery of tests sometimes done. And so I wanted to understand, like, what was the testing like? Is it different from your traditional, like, lab profiles that, primary care physician would order? What are you guys looking for?
So that's interesting, too, because I didn't really know when I started how much testing I would be doing and where it would be focused. And so after the past 5 years, I have a much better idea of the kinds of things that I look for. And I would say the testing, I use definitely the testing that other physicians have done. So I'll take a look at all of the labs patients come in with, even over the past several years. I'll look at testing that, for example, naturopathic physicians have done for my patients. But the kinds of things that I look at vitamin D levels all the time, because you can tell me whatever study you want, you can first of all, the answer you get to any study depends on the question that you just asked. I'm sorry, but that's the truth. It's whatever filter you're looking through. And vitamin D is an essential part of building blocks for steroids. I mean, for lots of things in our bodies. It has almost hormonal action to it. So, and it is definitely associated with low vitamin D levels are associated with things like inflammation, more cancer, more chronic disease. So I'm not saying that I want somebody's vitamin D level to be at the top of normal, but I definitely don't want it to be at the bottom of normal.
Right.
I like it to be somewhere in the middle range. Yeah. And in Vermont, we don't get enough vitamin D, that is for sure. So I'll check vitamin D levels, I'll check some nutritional labs, I'll look at things like iron stores, magnesium levels, and that kind of thing. Right. Sometimes I take deeper dives depending on what the patient comes in with, what I think is going on. And I did have a patient probably a couple of years back who, again, had sort of mystery symptoms and had seen lots of specialists. And it was funny, her primary care physician was leaving, he was relocating, and he sent me a bunch of his really hard patients. And I thought this guy was brilliant. So I was like, wow, he must really think something about integrative medicine. So I kind of vowed that I was going to get to the bottom of it. And by the end of our work together, I had also ordered some hormone levels, and it turned out that she had hormone suppression. And it was almost like she was postmenopausal, and no one had really thought to go into that. But based on the first conversation we had, where I was asking a bunch of questions, it came to mind. We talked about it. We said, okay, if this doesn't pan out, we'll get to that. Italian, I talk with my hands. And she got better when that was addressed. So
that's wonderful.
Yeah, it is.
Wow, so much that we could talk about.
Yes.
And yet we also have to try to, keep things tidy and concise to a certain extent. So to wrap up, is there anything that you feel we haven't touched on that people just absolutely need to know about integrative medicine?
I would say that when I do a lot of teaching, and I love to invite my students and my colleagues and my patients to really start paying attention in their own lives to the connections between, for example, how they eat, how they sleep, how they feel, where their stress level is. I feel very strongly that self-care is a cornerstone of health, and it's something that a lot of us blow by because we don't have time for it.
Right.
So I would say that if I have one message to even my students, I say you'll do a much better job being a great doctor or a great nurse practitioner if you learn to take care of yourself, because then you can share your own experience with your patients and you can be a role model for it and inspire them to do the same. So
Right.
I would say that is a cornerstone of integrative medicine and just really being a good doctor, and it's what I would recommend.
Yeah. You can't give if your own stores are empty.
Exactly.
So if you're depleted, there's not going to be a whole lot of you to give.
Yes, fill up your own teacup first and then work from the overflow, which obviously isn't always possible, but let's keep our focus there because we can
Right.
do so much more that way.
Yeah, yeah. And I think the other thing that you're making me think of with the thought of self-care is that self-care is an expression of self-love.
Yes, true.
You know, and so if there isn't a whole lot of love, you know, self-directed, you know, genuine internal self-appreciation, the body's going to reflect that. So it's a
Yes.
whole lot harder to heal if you're in a place of, you know, neglect or lack of love.
Yes, and we have to love the, quote, broken parts of ourselves as well, because
Right.
they're not really broken. I mean, they're broken but still whole.
Right.
Yeah.
Yeah. So if you've just joined us in the last few minutes, my guest today has been Dr. Andrea Fossati, and she's a practitioner of integrative medicine at UVM. If you want to learn more about her practice, you can visit our podcast page, which is thrivewithmarala.com/podcast, and find a link to her practice there. Thank you so much, Andrea.
Thank you.
It's been such a pleasure to have you.
It's been really fun. Thank you so much, Morella.
So we will say goodbye to our YouTube friends. And